Regulation, IMT, PAHO, WHO, who will share a message here regarding the 25th anniversary of the PANDRH network. You have the floor. Hello again. Good morning. This is the third time I have the floor. I am deeply grateful for the opportunity. I think today will be the last day of today, so you will not be bored by me. We'll give the opportunity to other members of the PAHO team to facilitate and moderate. Your Excellencies, authorities, colleagues, dear guests, ladies and gentlemen, it is a pleasure representing the Secretary of the PANDRH Network to introduce this commemoration and balance ceremony of the 25 years of the network. 25 years ago, we decided to promote pharmaceutical harmonization in the region as a contribution to the quality of life and the health services of citizens of the Americas, with the approval of Resolution 4211 of countries members of PAHO. The innovation, access to medication, and technology of PAHO, relatively new, as I explained earlier, is proud to be the secretariat of the PANDRH network. We have the responsibility to promote, coordinate, and implement technical cooperation of PAHO in the rational use of health technologies. PAHO works along with countries to overcome access barriers, face challenges in every stage of the medical products, strengthen regulatory capabilities, and support approvals based on evidence, plus recommend the rational use. Many of these cooperation is old. It had been practiced over the years by many of the members countries. This work is in close coordination with countries of the region. And with the creation of this new department last year, PAHO decided to increase and diversify technology cooperation, grants us the support to innovation and regional production processes, which are also part of this department through the regional platform. PAHO, as a secretariat of PANDRH network, not only has the responsibility but also the mandate and the mission to strengthen technical cooperation with countries and to strengthen and reinforce the work of the PANDRH network and of the secretariat. The COVID-19 pandemic isolated us and put distance between us, slowing the works of the network. After our last conference in person, and now I would like, on behalf of the Secretariat, to thank you for the immediate response and your support to continue with the activities of the PANDRH network, and particularly to the government of Mexico to help us celebrate this event. Before giving you a summary of the objectives of this conference and give the floor to Dr. Mariluz Pumbo, who is the Unit Chief of Quality and Regulation Department, I would like to highlight some aspects of this network. PANDRH network was pioneer, recognizing that harmonization and regulatory convergence processes are not only necessary, but they should also answer to the needs, asymmetries in the health policies of this region. This network had the advanced vision that the strengthening of regulatory capacities of the region requires the promotion of the cooperation of regional and national and international stakeholders. PANDRH network has been innovative in its inclusivity and governance, creating dialogue bridges between regulated and regulating entities, as we have heard today. The network and its members have achieved specific goals, like Dr. Pombo will explain, in the matter of harmonization and convergence in 25 years of experience, and has evolved and changed as a network, and also has learned to answer to the new challenges. Today, here in Mexico, we are at a crucial moment to potentialize and renewal, learning, opening to new ways to work and face common problems, but also specific to the region and its countries, of the regulatory functions and access to health technologies. On the foundation upon which 25 years are built, we have the opportunity to promote and reinforce regulatory frameworks to include all essential products for the health systems of the region. In the light of accelerated technological advances, we must make sure that all the products, health technologies find a space in the PANDRH network so we can have a more efficient work and achieve a positive impact in public health. Our region has the need to build and strengthen efficient, integrated regulatory systems along with health system able to include an expand ecosystem to promote production and expansion as complementary factors. We are pleased to see that in the past 25 years, we have expanded the participation of the member of mechanisms of international and regional harmonization. The recognition that member states did 25 years ago is part of the global recognition that this type of fora needs to exist, and there's plenty of active participation of you in other regional and international fora. With this, we can increase representativeness and strengthen the voice of the region in these relevant spaces. However, we are convinced from PAHO and the Secretariat that a regional forum is still fundamental to assure inclusivity and that our voice is coordinated, harmonized, oriented towards the exterior of the region, and we might find spaces of regional cooperation. We must move forward towards this goal, always with the purpose that we need to strengthen regulatories through the facilitation of equitable access of the people to technology and essential services. With this distinction and the roadmap, we have the opportunity to renew the harmonization and strengthening of the network through this important regional dialogue. And now I would like to give you a summary of the agenda of this conference and specific objectives. The conferences of the PANDRH network, this is the 11th, are so much more than a space to exchange information. It is a space that strengthens our cooperation as a network, strategic to decide on specific work agendas. This year is strategic and necessary for the region. Our objective will be to deepen in our achievements, but also in the challenges the region faces for the harmonization, with this objective to promote access. The recommendations and conclusions to be adopted will be our roadmap, and since the PAHO Secretariat, we are committed to implement this. We have 3 days ahead of us with ambitious plans, 9 plenary sessions, 4 discussion panels on priority topics reflecting the common issues of the network. The creation of this agenda was drafted with members of the PANDRH network and the government of Mexico. We spent excellent hours of consultations reaching a consensus on the topics that are a priority for the region right now. And the program includes new topics updated for this conference, like digitalization, artificial intelligence, and medical devices. All technical sessions of the conference, as diverse as they are, they share 3 common topics. One is good regulatory practices, 2, inclusion of every health technologies, expansion of our network to new technological areas, and 3, cooperation in the quest of regional regulatory efficiencies, recognizing regional needs, but also individual for members country. I invite you to actively participate in these conference sessions. We want to hear from you, learn about your needs, so we can work on a sound, a specific roadmap for this. As an IMT director at the Secretariat, my door is always open to hear and learn to strengthen is not only my mission, but my vision as a public official from PAHO. Before giving the floor to Mariluz Pombo, I would like to reiterate PAHO's commitment to this conference and these objectives. I would like to ask all of our colleagues from PAHO, members of the team and the IMT department, but also staff from the country office, please, if you could stand up. It will be impossible for me to recognize each of you individually for all the work you have done for past month. And I want to mention Dr. Pombo, Unit Chief, Begoña, Begoña and Damian. I cannot see them, but they are part. They are an essential members of the team of the PAR network, but all of them standing, they are people committed to public health with the strengthening of the region's systems and with access. It is a pleasure to work with you all. Thank you for your service. We can move on with the conference. Yes, hello, good morning. I think I have a difficult task on me on the agenda's time and make a stop, a pause to enjoy Mexican cuisine. So I'll do my best to honor 25 years of work of this region in the matter of drug regulatory harmonization. Well, first, it is difficult for me to be the person telling this story because we have in attendance people that were our founding members of the network, and perhaps they have a better memory than myself to tell the story. So, well, we tried as part of a team to find a moment to reflect on the story. I don't know why the screens are not changing. You know, these things happen. Okay, well, I'll continue while they share my presentation. In this audience, not only do we have founding members, but also we have people that have change in roles and positions throughout different their membership. Some of them were regulators, member of initiatives from centers of excellence. Others are members of the pharmaceutical industry. Others have joined initiatives promoting innovation and technological development, and many others that, regardless of their categories, they are permanent collaborators of this. Okay, I can see that my presentation is being shared, but in the side screens, but not here at the center. In this session in particular, we wanted to highlight this, focusing in what you see on screen. On one side, what do we want to achieve with regulatory harmonization based on the principles of PARF network? And I want to clarify that I was not coordinating the previous participations, but many messages can be still sustained, which are the origin, evolution, and main achievements in the Americas trying to find this harmonization, which are the persistent challenges because nothing is perfect, and which are the opportunities and some aspects that from the secretariat of this network should be in the discussion of the future of the PARF network. I'm sorry, I still have issues changing the screen with this clicker. Let me see. No, not there yet. I think we have it. Yes. Okay, so What I mean by what we want from the regulatory harmonization, this network has referred along its life to make sure that an effective regulation of health technologies can promote and protect public health through assurance of quality, safety, and efficacy of health technologies through the fight against under quality and false medications, providing necessary information to health professionals and patients for the rational use of these technologies, and also prevent that access to health technologies presents obstacles by inefficient regulatory frameworks. In this context, we cannot lose sight of what all the previous speakers have said, that the market for medical products is highly globalized, and convergence and harmonization of the regulatory aspect is critical in the promotion of innovation, enabling a facilitating dialogue between peers to reach a comprehensive regulation along the life cycle of medical products. If we had to use a popular phrase, I would say that an image speaks better than words, and this is the image portrayed in the screen, which is the value of regulatory harmonization and convergence in this phrase. And it is to minimize obstacles for the equal and timely access to medications and technologies that are safe, efficacious, and of quality as a requirement to achieve universal health. As you can see, these messages have been spoken earlier today, but as part of the Secretariat, we take this as the history of our network. When we go back to the creation of the PANDRH network, many of them mention 1999, but very few remember that the first two conferences promoted by the associations of pharmaceutical industry in Washington at the PAHO headquarters wanted to underscore the renewed interest in the regional economic development, regional of the Americas. And that is why we set the foundation of this network. So the regulation of pharmaceutical products and the harmonization of technical standards were an essential part of this effort. Later, before the need for initiatives to promote regulatory harmonization in the region and recognizing every asymmetry, we needed to create harmonization processes according to the realities of the region and sub-region. That is why in 2000, through a resolution of member states at PAHO, we formalized the creation of this network as such, with an operative model, bylaws, and all that. The flags, as you can see on the screen, reflect the countries that have held conferences of PANDRH network, and this history, Mexico has been host of this conference twice, first in 2016 and today in 2024. Across the evolution of the PANDRH network, you can see that we have a central hinge, and this is because this network undoubtedly wanted to adapt to a situation and specific needs that in the matter of regulation in the Americas region should be addressed. That is why on this slide I can show you two eras. Before 2014, the focus of the network was on the regulatory harmonization with technical working groups led by the Secretariat working on technical documents, providing training for human resources to reach adaptation and implementation of these standards at a national level. Plus, in this period, the Americas region was pioneer and required PAHO to establish a mechanism to recognize regulatory capabilities in the region, defining a methodology to assess operability of regulatory systems. And before that work, in that first period, we reached what we call now like 8 authorities of regional reference recognized in the standard frameworks in most of the countries of the Americas region, and that today are positioned internationally with a greater challenge, that is to make that this recognition that was granted to the Americas region, it was a peer recognition that will be valid in the region and internationally as well, achieving the transition of what today we have a transitional WHO to an international recognition list, promoting practices of recognition of other jurisdictions, practices to achieve access to health technologies, pre-qualification of WHO, plus it works in order to exchange these best practices in order to promote these regulatory frameworks at a national level. In 2013, in one of the conferences of the network, there was a deep discussion on the operative model that the network used. There were changes in the bylaws. Regional reference authorities were empowered to face the challenge of specific topics, and in 2014 a new operative model was adopted incorporating the acting of the network, the regulation of other health technologies like medical devices, and even for countries with more advanced regulation, these devices represented a challenge. The new operative focus, as you can see, was adopted in 2014, and it is based on the strengthening of regulatory system and their capability to supervise the life cycle of medical products. It is stated for the region and for the international arena, and we had a call to reconsider the human resource so these will be sustainable across time. As you all know, the COVID-19 pandemic, that you can see it in the virus image here in the slide, in the timeline, highlighted the vulnerability of the health systems. And in 2021, the only conference of this network was in virtual format, focusing on the discussions on how regulatory systems should be adapted to the post-COVID-19 agenda to contribute to the needs of the health regulatory system, not only in regular conditions, but also under emergency conditions. I think I managed to master the control here on the clicker. But yes, I think I did. Under main achievements, and not to bore you because you will have access to this presentation, we separated them in 6 conferences. We have had 11 conferences, as you saw in the previous slide, that has promoted the discussion and the recognition of priority topics common to the network. We have promoted a space between regulators and the regulated sector, and we have worked on multiple documents and guidelines issued to standardize regulatory processes and achieve their adoption in some regulatory frameworks in some countries. There is an image that I would like to live in this slide because it was part of the reflection of the change of operation model, where in the conference of 2016 in Mexico, by chance, there was the launch of a collection of experiences and lessons learned in the region in the matter of strengthening of regulatory systems.
So I'll read this document, which still is, it's in effect, it's enforced. I mean, we've compiled so many subjects that are part of the wording in it. You're going to find best practices, laws, regulations to improve access, and all these chapters of the hindrances, obstacles that the network had to foster to really promote the common standards at a regional scale. As part of the other 3 achievements that we wanted to highlight as well, I told you there were 6, and that's how we clustered them up. We grouped them up. Under the operational model that's new, the network achieved technical projects that were created to tackle problems, gaps with technologies and specifics. We had the capacity to acknowledge the regional regulations, as I've mentioned before, at an international scale. Based on regional experiences and laws and regulations, those were the grounds, the bedrock to establish the methodology along with the rest of the instruments that determine the functionality of the global healthcare systems and method. This network and the regulators that are here sitting at this venue helped draft the tool, create the tool that today is called GBT at an international scale that regulates the way in which regulators are measured to foster and promote best practices amongst nations. Who's been favored? We shared best experiences, learning experiences amongst peers review that strengthen our economies, besides having adopted international platforms to also share best practices and information amongst member states. As part of the challenges that I've just mentioned, not everything's perfect here, but the region has pending subjects, pending issues on a day-to-day basis. On one hand, we have to understand the regional context that's ever changing, that's been affected by situations, emergency situations, pandemics. We need to regulate and be prepared. Throughout the whole program, this three sequence of conferences have led us to really go through amendments to the general regulating frame, the mandate, so we can all be better prepared. But being prepared, or that preparedness, is it's not the common case. Sometimes, I mean, there's some that just stay, there's what's customary, what's tradition, that's not part of the wording or the spirit of the law. And we're going to discuss that in other sessions in which we're going to discuss the chapter of pandemics. That's something that we're going to be discussing in this sequence of conferences. That calls our attention. It's very difficult to keep an updated law based on the previous experiences that we've compiled. The asymmetric conditions of what's been done in the region exists. We have the capacity to regulate what's happening at a regional scale. There's variance, though. You heard the participation, the announcements of different keynote stakeholders that opened to this dialogue, high dialogue, and the previous sessions that we've held. In those sessions, we proved that there's different realities for us all. There's specific situations that a country has to create its own regulation. So this is something that we don't have a tailor-made solution. It's not the panacea for us all. There's regulations that might not be the best regulation models for all the economies. It's not just that you get a document, law, an act translated, and it applies to everyone and every healthcare system, and everyone's different. There's multiple regional integration capacities with different strategic pillars or axes. The different stakeholders that are summoned here today can go through a process of adjustment to go to the forums, go to the conferences. Those are engagements or commitments of each economy, a country. In the last conferences that we had to regulate and harmonize laws and regulations, we invited many regional countries or countries from the region that have invited the government officials in different levels with regions, and they're highly engaged, very committed. We invited these stakeholders to those sessions that are on board to draft the initiative. So within the section of opportunities, this network and the region has opportunities. So That leads me to say that it's possible for us to really solidify our efforts based on those opportunities. But let's be all very mindful, very, very deep about that throughout these days and future days. How do we work in synergies and in synergy link this initiative to others? How can we be efficient with communication strategies amongst our network? It's regional. It's a strategy of communication. We have to be thorough and follow the advice that's issued by this network. With our network, we can really work together, cooperate as a response. We have human capital, we have an accrued knowledge. We need to think about how to improve the regional development with initiative and technologies. It's necessary, it's imperative to broaden the scope of works of the Spark network, regarding the development of technologies and medical devices for the healthcare fields and agencies. The regulating systems are just quantified, they're just a few. We have revisited or learned about these endeavors on our day-to-day basis. There's agencies that have a strategic mission and vision, and part of the mission and vision is having people have access to it. It's part of our initial dialogues. So, as part of the future or this near future, based on the right perspective, based on the Secretariat's understanding of the network, we'd like to ask you to really be very thorough about understanding the mandates of member states that ratify, that are part of the OPS, the PAHO. I mean, we drafted these instruments back in 2022 to strengthen our mandates, our laws and regulations. It's urgent for all the economies and PAHO to strengthen its network and its authority, its administration, the Secretariat. We need to review the strategic plans and the operational model. We need to strengthen the governance model, the internal governance model, maximizing the resources that we have available, fostering the exercise of resources on situations that are not common. We need to visualize and integrate the work of this network with a clear goal under synergy that gives an immediate response to the regional needs. We've heard about from the initial speech of this morning with the government officials that have been there. It's necessary to really solidify the bedrocks of the PARF and PAO networks regarding the development of IT, technology developments and solutions that give us a capacity to give an immediate response to any health sanitary risks. Last but not least, and this is my last slide out of the slideshow, so you can rest a bit from this morning phase of conferences. I know that we've had a very robust, very interesting sequence of participations with keynote stakeholders that are part of the forum, top dialogue. So be very mindful with this quote this question that I'm going to prompt. I invite you all throughout our journey or throughout the program to be on board. So we submit interesting proposals, interesting initiatives, so we can rethink or re-engineer how to, improve the network in our region. I remind you, we need to harmonize the laws and regulations efforts for the pharmaceutical industry, strengthen the regulators at a regional scale as the bedrock. It's the base so we can give access to our citizenship, access to top quality technologies, medications in compliance with the laws and regulations that foster innovation and development in our governments and states. Thank you for your attention. Thank you for that full attention. I hope that we're honoring the celebration of the 25 years of this network. We thank profoundly the members of the Secretariat of the PARF Network. Thank you for what you submitted as your presentation. A round of applause for all the authorities. Thank you. Before we celebrate the conclusion of the first phase of top-level dialogues in this conference, I would like to share a couple of announcements. Very important announcements. Initially speaking, I'd like to tell you, one, that the Federation, the Commission of the Federation to Fight Sanitary Risks offers training to train your personnel in different sectors so we can, satisfy the needs of the citizens in the population. So we train, technically speaking, the producers at a regional scale of people that come from Mexico City, specifically from the region of Mexico City, Xochimilco and Milpalta. Now, in that sense, all the farmers were trained here. So we ask you to visit the stands outside because all our farmers have been trained at the Federal Commission to harvest. So they're offering and selling products as honey, bee honey, mole, arts, crafts, cookies, and snacks that you can also pay with different mixed payment methods right outside this venue if you want to look around. And another announcement, once we conclude this top level segment of dialogues, we're going to reorganize the venue. So we're going to ask you all to take your belongings with you. Please take all of your belongings with you. And lastly, I'll ask the government officials, the authorities, vice ministers, excellencies, authorities in general, please